It's a scary time for the country, Ash, and I think it's a scary time for this reason. Previously, we've been of the view that you could have a few cases bubbling down in the community and clamp down on it with contact tracing and isolating contacts. New South Wales has been very successful with that, and other states have had a go at it as well. The concern here is because the Delta variant is reportedly 60% more highly transmissible, we've seen in Sydney that the contact tracers couldn't get on top of it. So without much higher levels of vaccination, as you said in your intro there, it appears that we are going to have more of these lockdowns.
And Andrew, on that issue of vaccination, we heard the Queensland Premier and her team really sheeting home the blame to the federal government on that front. Also, again, more pressure from state leaders when it comes to hotel quarantine and incoming arrival traveller caps to be imposed. The federal government here, under a lot of pressure, is this just blame shifting we're seeing from the state premiers? What's your analysis of where the blame does lie?
There is some blame shifting, Ash, but that's not the end of it. The fact is the federal government hasn't done enough on vaccination, and for Gladys Berejiklian to be thumping the tub as hard as she is when Scott Morrison and co have been praising her shows how concerned she is that they're not ready for a further, bigger rollout of the Pfizer vaccine. Before 11:30 this morning, we had Anastasia Palaszczuk and Gladys Berejiklian attacking the federal government. Now, both of those governments are responsible for these outbreaks. The fact that a driver of air crews wasn't vaccinated in New South Wales, that's led to the WA lockdown. The fact that a hospital receptionist wasn't vaccinated in Queensland, even though the law required her to be, and also that they put a mine worker from the Northern Territory next in an international rivals hotel, so he got COVID, and that's resulted in the Northern Territory and potentially a South Australian lockdown and the Queensland lockdown. But nevertheless, I think they are able to argue that if there was a greater level of vaccination, there would be less spread of the virus, there would be less serious cases that we risk, and therefore the country would be in a better position, and that needs to occur as quickly as possible. I think people have made the point today, the federal government will say to you there's 20,000 COVID cases, even though they've got 50 to 60% double dose in Britain. 3/4 of those cases are unvaccinated people, and there are something like 3 deaths a day. There are similar numbers last year, there were hundreds of deaths a day. So that's what vaccination can do for you. Vaccination is not the way out of this. Unfortunately, we're going to have to live with this virus for a long time, but it's a hell of a lot better place than we're in at the moment. Australia is very exposed at the moment.